Adults and children alike are tethered to technology through email, chat, and social media, fueling their run on what seems like a never-ending hamster wheel with coffee and sugary energy drinks. As a result, mental health has taken the center stage, but at what cost? How can we make sense of technology-powered mental health interventions, particularly those of the non-pharmaceutical kind? That's why my guest this week is Dr. Ryan Wallace. Dr. Wallace is an experienced physician and neuroscientist specializing in evidence-based digital mental health apps for depression, anxiety, and compulsive behaviors. He's the chief medical officer of 2 startups that we'll be discussing today. He also manages clinical research and ensures compliance. We love that in the digital health sector. There is no one better to help us understand the future of mental health in both children and adults. But first, welcome to this week's episode of Make Sense, a video podcast that simplifies complex topics at the intersection of tech and people. There are many. So whether you're totally hyped on artificial intelligence and ready for the robot takeover, or you want to crawl into a cave after deleting all of your social media accounts, I'm here with my guests like Brian to help make sense of what's going on so you can design yourself into the future. My name is Lindsay, the Lady Engineer. I'm a pragmatic futurist and human-first technologist, serial entrepreneur, and innovation consultant. If you're new here, subscribe on YouTube or wherever you get your podcasts. So let's make sense of technology's role in the problems and solutions associated with mental health. Dr. Ryan, you are a busy man.
Yeah,
I'm very grateful.
No,
I'm very
it's
grateful.
really nice to take a break, slow down, and just have a nice conversation, Lindsay.
Yeah, and get some appreciation from people like outside of the medical field or outside of your specific thing, you know?
I get kind of immersed in it, so it's nice to get an outside perspective of what we do.
Yeah, we're
Lots of
very
times,
grateful.
yeah, a lot of times we're all kind of innovating in our living rooms and in our offices and stuff. So it's really good to kind of take a pulse of what else is going on out there outside of our own little innovative worlds.
Yeah, 100%. So let's start with our first segment,
Okay.
Crystal Ball. What does the future hold? So
Okay.
this is where I call out interesting predictions that others made for this year, and the experts, my guests, tell us their hot take. I'm going to fire off some of these predictions, Dr. Ryan, and I want you to say, yes, I want that to happen, or yes, that is happening, or no, please no. Okay?
All right. Sounds
So
good.
keep your first answer concise, and then if I have some follow-up questions, I'll let you know.
Sounds good.
All right. So in the 50th episode of Make Sense just a few weeks ago, with innovation consultant and investor Melly Chow, she highlighted a 5 to 10 year consumer trend titled Augmentality Beyond Exoskeletons. So this is about extending mental and physical health and wellness through technology augmentations. Healthcare right now is very diagnostic. The solutions today help us feel less disabled, but this says we'll use technology to help people feel more able-bodied. Is this something you see happening?
Yeah, I think with the introduction of digital therapeutics, we're kind of using an external device to help us with our mental health. So yeah.
I think this also kind of alluded to things like Elon Musk's Neuralink, like putting a chip inside of our brain.
So implants and things like that. I think 6 years is a little too close right now. I know people who have been working on it for about 15 years. They're making some great strides. We have external wearables that can target pathways within the brain right now that are showing some really good results. So I think that is around the corner. But I don't think we're going to be, living in the Matrix anytime soon.
It's a fairly wide corner too, because you're saying 6 to 10 years, maybe.
I think, I used to, I went to school a long time ago back in Cambridge, England. There was a guy that was working on implants and things like that. And that was 2001, and his technology was supposed to be 5 years away or 6 years away. We're still not doing it. So, but he would have that, he would walk to a building and it would automatically open the door instead of him putting in a code and stuff. I think that stuff, could be around the corner, but not anytime soon based on the results I'm seeing.
A wide earth corner.
Yes.
wide berth for
Yeah, it's slow to adopt, but it'll be here
Yeah.
at some point, I'm sure.
Yeah. So let's focus on this year. Some things in 2024: virtual care, remote monitoring, and virtual reality. So 2024 will see the continued use and streamlining of remote treatment options to better meet the clinical needs of more patients, as well as easing the pressure on hospital capacity and staff.
Oh,
Yes or
absolutely.
no?
Yeah, absolutely. It's really interesting. There's a company out of Harvard that called Decimal Health that does a lot of research on this, and in fact, they say that the market is actually really slow to adopt right now. Physicians in the U.S. are just now starting to learn these codes, starting to see the benefits of these codes. So we're at what they call like a hockey stick adoption, where you're just starting to kind of get 1%, maybe 2%. I think it's probably less than 1% of the adoption right now, but it will soon take off, and the growth will be exponential.
Could you give us an example of what is that 1 or 2%? Like, so this would be on our kind
I would
of.
say it's less than 1%. Let's say, for example, remote monitoring of patients with cardiac illness. There's certain devices out there that allow for that. The big one that I know a lot of people in that space is with diabetes management. So you're doing a lot of remote patient monitoring through diabetes. Mental health support through remote therapeutic monitoring is starting to get adopted. It's way less than 1% right now. But the benefits are really effective for physicians that adopt it. And there's a really funny phrase that people say in this industry that it's not supposed to replace therapists, but therapists who don't use these digital technologies will be replaced because they just don't have the most cutting edge research.
So, and that is in line with, a trend from 2023. The AI will take our jobs, and most guests came on and said, no, it's not that AI will take our jobs in the immediate future. It's that people that know how to use AI better than others will take your jobs.
Yeah.
Right. And that's about just efficiency and leveraging tools
Yeah, work
and
smarter,
boosting
not harder.
performance.
Yeah, yeah, exactly.
Okay. So another one last year was healthcare worker shortage, tech kind of, augmenting the worker shortage, as well as, again, the same thing with ambient health monitoring. So the question is this really a trend over the coming years and not necessarily predictions that will happen in 2024?
Well, 2024, I think we're starting to see it in Europe. There's a lot of digital implementation to kind of improve workflows, especially where there are major gaps in care. So you look at it from the patient's point of view. If you look at their journey, there are ways to optimize it digitally. If you look at it from a physician's point of view, you really need to streamline, your workflows throughout the day because it can be quite overwhelming. So I think we see a lot of it in Europe that's being adopted, but I think through my conversations in the United States, they're very eager to adopt these things, but sometimes adoption is quite slow.
Yeah,
So I
one
think
of
we have
the
to.
probably like first 15 episodes of Make Sense, I had Dr. Jinsey Jacob, who is also an angel investor. She's an emergency pediatric
Cool.
doctor, and she just pointed out it's like the regulation, the bureaucracy, insurance covering these things. It's just all very slow. And I
Yeah.
always like to point out that like the technology systems running these big bureaucratic organizations like the FDA and every insurance company and every hospital are also contributing to how hard
Yeah.
it
Yeah.
is.
Yeah. There's so many when you have so many, I guess chefs in the kitchen or so many, so many working parts. To get them all aligned, going in the right direction
Yeah.
is quite difficult. We find
Yes.
that in London, where I'm based, there's a big trend among younger physicians to adopt digital tools to optimize their workflows. But there's a lot of resistance in the older hierarchy that runs the hospitals. So I'm 53 right now. I'm kind of at that gray zone of people that graduated from college and kind of knew how to use tech and started using it in their jobs. So it became more, we became more tech savvy at this age. That's not saying everybody older than me is not, but the ones that are running the hospital are somewhat resistant in many cases. So you have to find an entrepreneurial spirit that's running the hospital to really embrace these innovations and take the healthcare system to the next level. I think we're going to see a lot of that over the next 10 years or so. That's my prediction. You can test the next person on.
Cool. So finally, this was from 2023. Mental health will become the new annual physical. So in America, at least 1 in 5 Americans experience mental illness. Do you see this happening in Europe, in the UK, that the general practitioner is checking in on mental health too?
Well, as part of a normal history and physical exam, you ask questions about a person's mental health, and they can be very quick questions, but they can be very telling as well. Like, how much sleep are you getting? How are your
Yeah.
relationships? Are you having a lot of pressure at work? Things like that, and those answers can trigger a further investigation into it. So it should just be standard protocol of care. I do see in the UK and in Europe there is a big push towards it really highlighting mental health issues and providing support. Even when the system is a bit overwhelmed, they're trying to put a lot of money into preventative care and to public awareness. In the United States, I think that they talk about it quite a bit. It is on people's agenda, but I think that every system's quite different. So I'm not in the U.S. system right now, so as I can tell you
Gotcha.
from the European system where I've worked and the British system, there is a big push right now to make sure that everybody's mental health is in check.
That's great. That's great. So we're going to continue the conversation on mental health, but before we kick that off, I want to make a quick announcement. If you're new to Make Sense, I prepared a list of the top 10 clips from the first 30 episodes. So dive into the most insightful clips without having to watch full episodes. I want to save you time. I want you to catch up. Visit lindsayt.com dash or forward slash ms dash top 10. So that's lindsayt.com /ms dash top 10. That will be in the show notes. So going into our second segment, what do you know? And I know you know a lot. This is where us relatively intelligent tech ecosystem insiders discuss, a hot mess. And actually, this is a medical ecosystem insider discuss a hot mess that's making national news. It's kind of American centric, but I think it's a global problem. Ryan's an expert. I'm not. So, but we probably know more than you do. So I'm going to tell you a few headlines. One, anxiety and depression is spiking among young people, and no one knows why. And medical costs for kids' mental health in the US jumped 31% in the last 5 years. Can I get like a quick, your response to those headlines?
I think people do know why. It's multifactorial. We've had a couple of global issues with the pandemic most recently that do contribute to mental health. So yeah, I think there are a lot of contributing factors. We see anxiety increasing significantly amongst young people and in the general population. So I think that part of that part of that headline is true, but no one knows why. I delved into that article, and it was a survey, and results were mixed, and I think that's why there was that scandalous title. But basically, they were
I
saying that it's multifactorial. You got most physicians think that social media is a big issue contributing to anxiety amongst young people, academic pressures, family dynamics, societal changes and expectations right now in a modernized digital connected society, and also the impact of COVID-19.
Yeah.
So so you also have through that you see increased awareness. So through increased awareness, you start to get higher diagnostic rates and people seeking out mental health services. And that kind of coincides with limited resources. So it puts a strain on the system. So it's starting to create a lot of buzz right now in the industry because we're trying to figure out how do you fix this wave of patients that are coming in. And it's getting
Yeah.
worse. no, it's
I
getting
want
worse.
to throw out a few stats to the audience, and then I
Okay.
have some specific questions for you.
Okay.
So, in the US, approximately 1 in 4 American children is estimated to have a mental health issue.
Mhm.
Families that have a child with mental health issues are spending an average of $4,361 more per year on
Yeah.
caring for these children. uh, Child mental health services accounted for nearly half of all child medical spending in 2021. Uh, I like to look at root causes, not just surface level problems. And you started to hit on this, like
Yeah.
who is what to blame. And I
Let's
think
blame somebody. Yeah.
articles pan things out, like, mention things, the
Yeah.
pandemic and social media and family dynamics, environmental factors, maybe lack of independent skills, even. Whenever we're looking at problems to solve, I always like to look at root causes, because there's something I call the most valuable problem. That's a problem that if you solve it will make the other problems easier to
Yeah.
solve, right? So these articles cite a myriad of things, whether it's the pandemic, social media, family instability and other dynamics, social isolation, external events, lack of independence skills. So I guess, is there one that you think, if solved, would address more of the others?
Well, I mean, it's kind of a loaded question for me because my background is in social media addiction. Like, I got a PhD in internet-based addiction, so gaming addiction, social media addiction, porn addiction. These things were my specialization. So that's what I tend to focus on. A lot of kids that we diagnosed with internet, addictions or problematic gaming or whatnot, they tend to have high rates of anxiety and depression. The big question was the high rate of anxiety or depression the cause of the overuse of the internet, or was the overuse of the internet the cause of the depression? In some cases, you could clarify. In some cases, you couldn't. So I think the big the big solution for me is preventative measures. You were talking about the economics of it. They find that for every dollar that you spend, the results vary from country to country, but it can range up to about $15 in savings downstream for a family for every dollar that they spend on preventative. The same thing goes, I think, for companies. It's like for every dollar they spend on mental health prevention, mental health condition prevention, they save $4 in cost for the employee. So I think you have to look at, okay, what's a healthy amount of time to spend on the internet, and that's a different different number for different people. It's usually not a time related factor. It's more of a, is the time that you're spending starting to affect your real life? Is the time that you're devoting to gaming? Are you just a really enthusiastic gamer who loves it and that's your pastime? Or is this a problematic thing that's causing you to neglect yourself, to isolate from others, become depressed, to affect your job, your finances, etc., marriage in some cases as well. So yeah, I think you have to look at it on an individual basis. And one of the big things is a lot of physicians really still aren't aware of this. When I was specializing in this, I was waiting for my patients to come into the clinics, and they just weren't coming. But I knew, based on all of my research, that they were out there. So I started to do some hunting online. I found that most people who were addicted to the internet or who were addicted to social media or whatnot would go on to social media to discuss what they were going through, and they were looking in Reddit for answers on how to cure themselves. And sometimes they got really good advice, and then other times they got horrible advice from a clinical point of view. So so I thought, all right, let me take a step back, and I'll go online and create a company that helps people who are dealing with these issues. So that's a question that hits very close to home for me. But I think that we are becoming more isolated as a society. I've got a use case in my own intermediate group of friends. One family has kids who they don't let use devices all the time. And then the other family kind of gave them iPads when when they came out of the womb, And the ones that grew up with the iPads since birth have gone through a lot of mental health issues, whereas the ones who have kind of had to play and make it on their own and use their creativity and resourcefulness throughout life have really kind of thrived at the point where they're about to apply for colleges now. So you see a big contrast. Those could be isolated incidents, but unfortunately, with my patients coming in and talking to me, it doesn't seem to be so isolated.
So there are a ton of potential resources and solutions out there, some good advice, some bad advice. Free online therapy, maybe new school curricula, community building. How can technology address the gaps in access to mental health resources, particularly for underserved communities, rural areas, but even just the general population? Like, what is technology's role in
addressing these mental health issues? Yeah, well, that's where Calmsie comes in. I founded Tech Addiction Doc a long time ago, and that got the attention of the guys who started Calmsie. A couple of weeks after they founded it, they brought me in and said, "Hey, we're working on this. Do you want to join us?" So I became a co-founder there. And it kind of evolved from telehealth. So, that's the very foundation of what, digital intervention or digital platforms can do for you in a health setting. They can really facilitate access to, really good, high quality care for people in remote areas that normally wouldn't be able to get it. And with cost reductions, it makes it a bit more affordable. As we were as we were introducing that, we were kind of in a sea of brand new platforms that were offering telehealth. So we were like, well, how do we create more value to this? So we created chatbots, and our chatbots were really simple. They just followed basic, the CBT or cognitive behavioral therapy algorithms. And there were a couple of companies doing it at the time, one of which was Wobot. And one Monday we woke up and read that they had gotten $100 million investment. And we were like, oh, well, there's something in this, this sort of technology. So how do we take what we've done with our chatbots that were pretty effective, and our video technologies, and how do we create more value there? So we thought about it a lot, and then I saw Stephen Colbert one night talking to a cartoon on his show. And the guy who was voicing the cartoon was reacting to Stephen Colbert's jokes in real time. And I had never seen anything like it. And I was like, this is transformative. This is what we've been looking for. How can we integrate that into our chatbots? How do we do this? So I talked to our CTO, and he said, yeah, that technology is there. We can start working on it. So within a couple hours, we had a working video bot that could take our chatbots and start talking and expressing. They looked really scary at first, and I was like, "Ooh, this was scary."
Like, this might be like backfire on us if we launch this to kill children.
Horrible, you're thinking of the worst horror movie, and that monster in the worst horror movie going, so tell me about your feelings.
Yeah.
I'd rather not. So that was a hard one to pitch to investors. And then we started creating more skins for it, different types of avatars. And that's when it got really impressive, because we found that kids really kind of gravitated to it. And that's when we had our aha moment, like, oh, this is perfect for kids. They create an avatar and then they can talk to it about their mental health. And so we started testing it, and we found that they liked it for about 5 days or so. And then they were like, all right, there's something else that I've got to go play with. And so we were like, well, how in the world do we really increase engagement in that? And I think that comes back to your original point. With digital therapeutics or digital therapies or games like this, you can really engage a child and deliver care in a unique way, and in a way that they're used to these platforms, because a lot of kids spend a lot of times tapping their phones or their parents' phones, a lot of times, on games and things like that and other platforms. So if you can deliver care in a way that they're familiar with and comfortable with, they'll open up a bit more. So we were talking to our friends over at City Project in Poland. They created the Witcher games and Cyberpunk. And we're telling them our conundrum of, it's like Toy Story. You pull the string, it's great for a couple of days, but then they put it in the corner and it gets dusty. So what do we do? And they said, well, make games around it. That's what we do. And so I created
Right.
this amazing world. Like it was World of Warcraft, but for therapists, basically. And so I came back to them with this.
World of Warcraft right there.
Yeah, World of therapy, like,
Great.
something. It was real immersive, and my probably the most creative thing I've ever done in my life, and I was so proud of it. And I took it to the guys the next time we met at lunch, and they just started laughing at me, and they said, "Whoa, slow down there! Think Angry Birds before you think Warcraft, and that's going to be your secret sauce." And so I started thinking about it, and I was like, "Yeah, they're right." So we were able to make different games for different days that were, it was always there was a curiosity of what games would be the next day, etc. And so it really started to engage children more. Now, as a physician, when a child comes in and I have to assess them and their mental health, I spend the first 15 to 20 minutes going, so what's your name? How you doing? Do you like baseball? Do you like football? Things like that. And it's this, I'm trying to build rapport, but as a bald man wearing a white coat, it doesn't, it's really tough to build rapport with kids. But if I hand them a video game, they build their avatar, and the avatar comes to life and goes, hey, let's have an adventure. We're going to help this character overcome some anxiety issues. And then they play it, and then the characters start talking to them from the game and say, hey, do you ever feel like this? Hey, have you, what skills have you used in the past? Have you ever tried this? So it becomes a real engaging way for them to get therapy delivered to them. And through that, now we've gotten to the point where we can start to analyze language. So you can determine if the child's depressive. We're starting to analyze data, so you can look at different trends of when their moods are affected. Are they around certain people during their moods being affected? Are they?
That's really cool.
Situations? Yeah, it's
a side question for you. Have you ever seen Nick Kroll's cartoon on Netflix, Big Mouth?
No, I haven't, but I've heard Nick Kroll. I'm not. Yeah, I don't.
So Big Mouth, it's not for kids. Okay. It's for adults. But each of these kids is kind of going through puberty, and they have like their puberty monsters, but then they introduce like anxiety pests, like an anxiety mosquito. Yes. And a depression kitten. Yeah. I would love for you to watch it. I'd love for you to get back to me, because it's super interesting as an adult, actually. It's like very relatable, like going through summer camp and high school and dating, and you have these monsters and mosquitoes and cats that are expressing anxiety and depression and hormone fueled like irrationality. Well, and I would want to know from you if you thought that it was, accurate. Or
that's a key concept in psychology, is to kind of, how do you externalize and visualize an internal trait? And so we actually do that in the game. We have a monster maker in the game, where they can, if your feelings were an inner monster, what would it look like? So they're able to create that. Wow. And then how strong would it be? And we have this really weak monster, and then they can make the arms really big and everything. So it's quite fun. And now with AI, very cool. You can actually describe the monster, and then that can be integrated in the game. That's what we're working on for the next iteration in a couple of weeks. We're still tweaking that. I asked it to do a flame in the hand the other day. It gave me oh wow! Yeah, it gave me a picture of an astronaut with his hand on fire, like freaking out. So I was like, well, we still got some tweaking to do here. so it's not all rosy with AI.
The issue of isolation comes up for kids and adults. Particularly because of the pandemic, also because of the way social media has kind of kept us connecting, but not really connecting.
Connection, but it's in some cases. In other cases, it just facilitates. Like you and I talking here, it's a
meeting and having this moment. So the question I have is, does Calmsie have any socialization built into it, or is it really user to computer,
It's user to
single
computer,
user,
but
single
done in a
computer.
socialized way. Every conversation is personalized to the child. So no matter what they
Okay.
respond, that, oh, okay, I see what you're talking about, Timmy. It'll acknowledge what their issue is, and then kind of pivot to the scripted questions that we like to get to. So
Cool.
and yeah, when we get a lot of questions about, have you done like a social community, social platform with it? England tried that in my neighborhood actually a while back. They had this really cool platform that kids could interact, talk about their issues and stuff like that. And they found that it had to be mediated so intensely because there was so much disinformation out there that
Right.
it really discouraged me to take that step. But we'll try at some
Right.
point.
So for Make Sense listeners that do want to explore the topic of safe socialization, I do have a past episode with CEO and co-founder of Neon
Oh, this
Wild
is yeah.
about safe socialization. So they have virtual worlds and custom avatars, and I sent him information on
Oh,
Calmsie. Their intent is because is for children to see themselves as the hero in virtual worlds. So customizing avatars to look like them,
yeah.
whether,
There's this
skin
really
color, race.
fascinating study that Nicholas Yee out of Stanford did. He worked with 80,000 gamers and talked to them about, what motivated them to choose the avatar that they chose and stuff. And some of the use cases were amazing. There was a kid with an
Mhm.
oxygen he had to wear oxygen mask and things like that. And it was really, very, very affected by an illness and very physically, disabled. But his avatar was, it was very strong and powerful and could fly, but it also had that mask. So there was a personalized
Mm,
touch to what he created. It was really, really fascinating to see some of those. So I encourage your listeners to check out the work of Nicholas Yee.
cool. With Calmsy, are there any partnerships or initiatives in place that are helping to address the broader systemic issues affecting children's mental health? Is that in your
Yeah, that's
roadmap
in the
or your
roadmap. Right
vision?
now, we're at the developmental, like we're the ending stage of the developmental process for one of our products. We put into 6 different studies. Poland has been very generous with our product so far. We've done some user experience testing there that's gotten really, really good results on our first couple of iterations. We had to do an adult safety trial with children, and that was it was 100% safe, they said, which means basically there are no adverse events. So it's, yeah,
Mhm.
so that's how they phrase that, no adverse effects. And then yeah, so we're finishing right now to get, I think within 2 weeks, I think we're going into our first of 6 clinical trials with children. And then after that, then we'll start to expand as you suggest.
Cool. So before we start talking about your other
There
startup,
is there is an
uh,
overlap, by the way, yeah, with those.
yeah, I'm sure there is. We'll get there. With Calmsy, you're in clinical
Mhm.
trials. Is there a way for listeners to currently get involved, or is it more about just following
Yeah, check
along?
our website out, www. And then the game is called Mission Amygdala. Every day the kids are given, a space mission. They have to help certain characters overcome emotional challenges. So if you go to www.missionamygdala.com, you can read more about the game. And yeah, sign up to our mailing list so that when that's available as a B2C product, they'll be the first to be able to get that. But right now it's in test
Cool.
mode. But it's really cool.
Awesome.
I've been designing and playing it. And a lot of times in the past when I've designed and played, I didn't really want to play anymore. But now it's getting to the point where we've got so many different data points and so much personalization and so much engagement that it is actually really cool. And
That's awesome.
the kids that we test it with really enjoy it. And we always say that, you're helping us make this game. So they kind of say, oh, I want to play my game. I want to play the one I
Yeah.
made. And so it
Yeah.
shows ownership as well. It's
So
cool.
that's great when you have those kind of early
Yeah.
adopters and you want them to feel ownership.
Yeah,
Uh,
absolutely.
for our startup founders listening, you want to provide that experience because that's when they really start to like advocate for you, introduce you to other people, talk about you to, other potential users.
Yeah,
So
we got a
for
lot of we got a lot of publicity because of the user experience testing that we were doing back in Poland. We were on morning shows talking about it. We were invited to the UN to talk about it as a result of that. Our CEO did TED Talk on it, and the big take home for the entrepreneurs out there listening who are making digital products is there's some really good products out there that can be really effective, but if the user experience is bad, nobody's going to use them. So make sure that you don't skip that process, especially if you're a scientist who knows exactly how to cure it, but you don't know how to do the user experience testing. It may be the best product in the world, but nobody will use it if
yeah, and to tie that up, there's a term called the gulf of evaluation.
okay.
It's the time between someone seeing your product or thing and knowing how to use it. And if that gulf is too wide, they're not going to use
Yeah,
it,
yeah.
right? So, and that's where usability specifically different than maybe how other people define user experience, because there's too many definitions in there, but actual usability is really, really important. And you make a great point.
Mhm.
So for our final segment, reputation repair, tax redemption. So despite our perceived frustrations with the consequences of many existing technologies, there are groundbreaking innovations. We were already talking about one. There are groundbreaking innovations that will reshape the world and solve pressing issues. So you have another company product called
It's another
Neuralpositive,
company,
which
yeah.
has a
Mhm. A
has a
whole
pen
separate company, yeah.
yeah, it's a whole other company and product, which has a patented medical grade music intervention to improve mental wellness. Can you describe the innovative approach Neuralpositive is using to leverage music and technology to improve mental wellness?
Yeah, this one's really exciting because of the evidence that's being generated by this. When I was in med school, if you told me that I would be working on a music therapy intervention app or something like that, I would have laughed at you. In fact, me and my best friend in med school went out to a party one evening and we met these girls and we were like, "Oh, so what do you guys do?" And said, "Oh, we're music therapists." And my friend was like, "Ha, yeah, you're a music therapist, right?" And we just kind of laughed and, we're doctors, we're very pompous. And I have any podcast I get on to, if those girls are listening, I apologize profusely because I
Yeah.
started to see the evidence, when I started working with Neuropositive, and it's incredible what music therapy can do.
Oh,
But when you personalize it and put mathematical models and algorithms behind it, it can become so powerful. So Yasmin and Peter and Jim, the founders over at Neuralpositive, really put together an amazing product that I've been tasked with testing and validating. And we've done a preliminary study on interstitial lung disease patients that were experiencing high levels of anticipatory anxiety due to when they go to get their evaluation at the clinics, they're quite painful. So people with anxiety tend to exacerbate that anxiety before in anticipation of this
right.
pain. So we were able to reduce those anxiety levels in our cohort of patients by 50% or more before they went in, and that's really impressive. That's a standard of care that we can start adopting. Go ahead.
So let's take a
Okay.
pause. Let's just reduce really makes sense.
Okay.
So we want to make it super
Okay.
simple. With Neuralpositive, there's an API with Spotify, right?
Yeah, I think it plugs into your existing playlist. So I'll take. I guess I should explain the product, shouldn't I?
Yeah, like let's do like what are the Lego
Okay.
blocks that are put together to deliver the music
Okay.
therapy?
So basically, Neuropositive has this application that takes your existing playlist and puts a 4D dimensional music model into use where it analyzes the music, analyzes certain several points of the music, and then applies that to an emotional model based on the person's emotional state, their physical state at the time as well, their mood, etc. And it applies it to optimize their mood from anxiety, who's experiencing high levels of anxiety. Apply this algorithm, find the right music at the right moment. They listen to it in this certain sequence, and it can optimize their mood, so reduce anxiety. And in many cases, we get it in about 8 to 12 minutes, a result. So a 30-minute music listening session, medical grade music, is quite effective.
So I believe, because I spoke to you and Yasmin back in February, this is what I remember. So I'm going to restate
Okay.
it for the audience, and you let me know where I'm right or wrong. You're also using, so you're taking someone's listening history, and from, I believe, Spotify, but you might be using other music tools, but you're taking their listening history. And then you're also taking inputs from IoT devices, mainly like Apple Health, Apple Watch monitoring, the health monitoring there. So if their like heart rate has jumped or anything like that. I think you also ask,
and things.
yeah, biometrics. And then you also ask questions too about how they are feeling. Suggest music that will address that mental health issue and calm someone down.
Yes. So yeah, that's a great way to put it. So when we do a lot of information gathering to see what that person's state is at that moment, and then we analyze their previous listening history, and based on the music that they prefer, we put together a similar type list that can optimize their mental state at that time. We're also using it for not just anxiety, but to reduce pain. And the reason why is we're optimizing music's ability to increase oxytocin in the body. And oxytocin is an anxiolytic, which means it reduces anxiety. And it's also an analgesic, which means that it can help you to reduce pain. So we're taking an external stimulus like music, which is very simple and easy to listen to. And we're giving something very passive for them to do, effects that create all these cascades that reduce pain, reduce anxiety. And in some cases, it can be as effective as a medication. So we're just still going through trials right now to make sure that that applies in every case.
Yeah, you're still trying to prove that at a clinical level that it meets some standards, right?
And
in
we've done that
healthcare.
through the pilot study. Now we're expanding those as well. So it's really exciting. Even in our user experience cases, perceived efficacy it has been an important metric as well. So people feel more calm after they do it. So music could be the next smoke break in work. That's my joke. You see,
I love that. Music could be the next smoke break. Yeah. So how does Neuralpositive adapt to different people's needs and preferences? Because I know there are some people who will listen to like heavy metal and that will help them. Why can't we just, turn on classical music and everyone calm down?
Well, for somebody who really relaxes listening to death metal or something like that, classical music could really increase their levels of anxiety. And that's why these AI-driven emotional and music models are so important. It listens and really evaluates that history. Now, one of the really, really interesting things is the studies have shown that people who select their music usually select music to reinforce a specific mood. So let's say you're sad, you choose sad. You listen to some Adele or whoever is on that playlist, or after a breakup or something like that. But with the algorithms, it discards that and says, okay, these are the things that we can do to optimize. So and the pipeline of potential possibilities is really impressive. You can use it for performance optimization. You can use it to increase focus before you learn a task or things like that. So it's I use it before I give a speech or something like that. It's really impressive. Yeah.
Very cool.
At tax season, it was really, really nice as well.
Tax season, yeah, it's really important.
Relaxing music.
Are there any data privacy issues. I told someone after I talked to you all in February about how cool this
Yeah.
was. And a cynic responded, like, of course, taking more of our data, you
Well,
know.
I think you can take data, but or you could leverage data, and leveraging data for the benefit of, for your benefit is probably the way you want to use it. We follow strict data and security regulations, so the data is safe, and we're using it in a
Hmm.
way that optimizes your health and your well-being, and doesn't share it
Yeah.
with the world
Yes.
to optimize it,
uh,
I guess. Yeah.
are there any ethical issues? Like, could music be manipulated to make us feel bad?
I'm sure it could, but we haven't explored those dark paths with music. I think that, it's very primal when you listen to music. A certain beat can make you feel uneasy, or a certain tone can make you feel uneasy. Certain songs can make you feel sad, just like they can lift you up. And so what we've tried to do is make the most supportive applications that we can with that. I don't think there's a great use case for making people feel too bad with music.
Okay. So both with Calmsie and Neuralpositive, you are facilitating and running medical clinical
Yeah.
trials, holding your interventions to the highest level. How do you feel about a lot of other mental health interventions that may not be holding themselves to that standard? And when I say other mental health, I mean like other technologies that claim to have mental health
Well,
benefits.
I think there's a place for all. I mean, the world's big, the population is big, and everybody needs, the thing that helps them. So I think companies like Calm and Headspace may not be, as evidence based as we are, but there's a big space for them, and people love using them. The same with a lot of wellness applications that are out there. But each company that's striving to have an evidence based FDA approved product, it's going to be held at a higher level, through stringent research and through robust findings. So I think yeah, there's a place for all of these applications. For us, we want it to be used by physicians and medical personnel to really improve healthcare outcomes. So that's why we take that
Right.
specific approach.
Right. So calling back to those trends and predictions we talked about in the first segment, that ambient health monitoring, that remote monitoring, these other, preventative measures that could keep people out of the hospital and help doctors manage more patients from afar. That's really where, Calmsy and Neuropositive want to
Yeah.
be, because seems like it really eases the burden
Yeah.
on a lot of people, not just patients.
It's not just health effects, it's downstream social effects as well. So if you can improve health in your population, then you're also improving societal spending. There's not as much societal support that's needed. Those resources go to
Mhm.
other things as well. So you have to look at it. We call it health economic outcomes, but there's also those social downstream effects as well that come from it. I wanted to mention the overlap of Calmsie and Neuropositive. The way I met them was we had a meeting. I had a meeting with Yasmin, the CEO or co-CEO of Neuropositive, and our visions aligned. She was really into the external stimulation of internal cascades through music, and I was into the same idea through therapy and visual cues and music and animation and storytelling and all that. And we found this perfect alignment. And so in our next study, we're going to be using a lot of the neural positive music to support the game. And I'm really interested to see what our results are like with that, because we've got AI driven to reduce anxiety and enhance outcomes. I'm
Yeah,
so excited to see those two products together.
that is really
Yeah,
awesome. I want to ask one thing or propose one
yeah,
thing. So both these things are in clinical studies. It will be a bit before B2C applications, before Make Sense listeners could be using this. But if there's like one takeaway with the way, what we're learning about neural positive, at least, is that if you pay attention to the music you are listening to, maybe if you're sad, choose the happy
It's just the
music
happier music.
to help you not be sad. Just be conscientious of the fact that if you're sad and you listen to like the Titanic soundtrack or Adele, it's going to make it more sad. And maybe that's what you want. And that the next morning you're going to wake up, in a better mood. You just want to dive into your feelings right now. But like, pay attention to the music and make better choices if you want to leverage music to improve your mental
Yeah,
wellness.
I think with the AI application, you've done a very simplified version of the explanation, but with the AI application, it takes into effect or factors in a lot of different variables. So yeah, it's much more complex. But yeah, if you don't have access to the application, then yeah, raise your awareness. It's that.
We don't have access
Yeah.
to it yet. We need you
Yeah,
to speed
exactly.
up.
It goes back to that old adage: put good things in, and good things will come out. I think is the
I mean, and that's an adage for AI
yeah.
too. Put good things in AI and good things will come
We were
out.
talking about in the beginning, like your introduction. It reminded me of somebody who I was talking to recently. He said, "Yeah, whenever I use ChatGPT, I'm always very nice to it, just in case it destroys the world." So, and he was like, "I'm not
I've had a
thinking,
friend say the same thing. I always say please
yeah,
and thank you just in case they take
yeah."
over.
I've actually asked it, "Am I being polite enough for you?" It's you're very respectful and focused, so we appreciate that.
I am so excited about Neuralpositive's
It's
commitment
really
to
cool.
harnessing technology to improve mental wellness. And I look forward to all your future advancements. Like, let's make it make sense. Technology might be part of the problem behind the mental health crisis, but it is definitely part of the solution going forward. And there are awesome people like Dr. Brian making huge strides that are coming our way. So thank you for listening to Make Sense with me, your host, Lindsay Tabas, and my guest, Dr. Brian Wallace, Chief Medical Officer of Calmsie and Neuralpositive. We hope you enjoyed our take on the future of mental health interventions. Dr. Brian, you gave us a bunch of links. They'll be in the show notes. Where can people find you online?
Look me up on LinkedIn. Yeah, Brian Wallace, MD, PhD, MBA. I think is the title there. So it's a lot of letters
We
after
will
my name.
link.
So look for the bald head in
Yeah,
Hong Kong. You'll see it.
so as always, you can check out all the links and resources in the show notes, including that list of top 10 clips from the first 30 episodes. Dive into those clips without having to watch a full hour by visiting lindsayt.com/ms-top 10. So final note, if you want to continue to be the smartest person in the room, make sure you're getting notified when each episode hits on YouTube. Hit that subscribe for next week's episode, and for audio only, follow wherever you get your podcast. Thank you, Dr. Brian, for
It's
joining
been a
me.
pleasure. Thanks, Lindsay.